This is a video recording of a hip resurfacing performed in a young man in his 40s for severe degenerative arthritis of his right hip. You can see from the x-ray he had a lot of arthritis. We begin by reaming out a cup-sized space in the acetabulum for his acetabular component, which is a thin shell of metal. You can see the reamer basically spins a hemisphere which removes an exact amount of bone to allow the hemispherical metal component to be put in place. Once the hemisphere is machined, the next step is to trial the different sizes available and make sure there's an appropriate tight fit that covers the component completely. We also, at the point of trialing, mark how far in the real cup should be placed. Here we are impacting the trial to ensure the appropriate position can be achieved and has sufficient bony coverage. At this time, once we determine the appropriate size based on the trialing and press fit, we bring in the real component, which is attached to an impactor here. The component is then pounded into place in the hemispherical position that was created by the reaming. Once we're happy with the position and we've checked it, we remove the device used to insert the acetabular component. We also, at this point, will inject some numbing medications in the deepest part of the wound. This is part of our pain protocol and reduces post-operative pain. We'll also provide some additional injections at the end of the case to anesthetize those structures that can be reached from the surface of the skin. Here we're placing a guide pin into the neck of the femur to allow us to machine the top of the femur or the head of the femur. The device about the pin is used to help ensure the appropriate alignment of the pin. Now that the pin's in, we'll remove the guide device. Once the pin is determined to be in an appropriate position, we can then over-ream the pin and switch to a guide rod. The guide rod is just a little bit more sturdy and allows us to attach several of the cutting devices that allow us to machine the end of the femur. Irrigation is used throughout the operation to reduce heat and friction and allow the equipment to work without causing too much in the way of tissue trauma. Here's the guide pin that's put into the hole that was over-reamed from the guide wire. Provides a sturdy base from which to work. Here we're going to cut off the very edges of the ball, prepare the femur for the metal cap that is the resurfacing component. Great care is taken not to dive beyond the very edges of the ball to protect those structures that are at the margin between the head of the femur and the neck of the femur. This is to prevent any trauma to the neck of the femur, which will see stress, particularly during the rehabilitative period. By carefully peeling away, we reduce the risk of cutting any structures beyond the margin of the femoral head. You can see from the video that this creates a very perfectly smooth round surface, which is one of the surfaces that the resurfacing implant sits on and transmits force onto the femur. Once we have this much bone exposed, we'll clean the bone of any marrow elements. Resurfacing hips do use a small amount of cement underneath the resurfacing aspect on the femoral component, and so they need the marrow to be washed out of the spaces in the bone to allow for some of that bone cement to interdigitate appropriately into the end of the femur. At this point, we measure the depth of insertion of the resurfacing component and mark the appropriate amount of distal bone to be resected in the next stage. In this case, we find the normal kind of neutral cut, and we cut a few millimeters above that in order to add a few millimeters of leg length. It's important to realize that with the resurfacing hip, unlike a total hip, we're limited as to how much additional leg length we can add. As you can see here, We're adding just a few millimeters to help him match up with his other side. Now we ream the end of the femur and create yet another surface for the resurfacing implant to sit on. After the distal end's been reamed, we put the chamfer cut in, which helps us finish up the preparation of the head of the femur for the resurfacing implant. Again, lots of irrigation to reduce friction and wash away debris and marrow elements.
Okay.
This is the resurfacing implant. You can see it just caps the end of the femur. We have a little bit of mixed cement, and we put in a small amount of cement. It doesn't really require a lot, and that helps the resurfaced implant adhere more firmly to the head of the femur. That's swirled around until it covers the inside of the implant appropriately, and that's impacted over the end of the femur. This can be compared to the preparation of the femur for a total hip, which will be found in one of our other videos. You can see a marked difference in how the femur is treated in those two different procedures. Here's the resurfaced implant impacted, basically reconstructing the head of the femur back to the appropriate level, the level it was before the disease process began to wear it away. This will be reduced, range of motion will be checked, additional medicines will be injected to reduce the discomfort of the surgery, and the hip is closed by Mr. Rosenquist, my physician's assistant, who assists on well over 1,000 orthopedic procedures a year. We appreciate his help, not only with closure, but with his enthusiasm throughout the case. I hope this video has been somewhat instructional. It can be helped with office visit, and further questions can obviously be answered. Thanks for your time.